Migraine. Lot of people in the world suffering from the migraine. Mainly, migraine is the headache. Headache is the mainly divided into primary headache and secondary headache. Primary headache mainly divided into three types: tension type headache, migraine, and trigeminal sepalgia. Trigeminal sepalgia mainly divided into the cluster headache and paroxysmal nemicromia. Secondary headache caused by intracranial pressure increase or CSF fluid reduce or CSF pressure reduce. Sign and symptom. Headache mainly unilateral. Severe throbbing pain and pulsation. Sensitivity of light and sound. Sometimes can't sit in or can't lie in the light and sound, associated with nausea and vomiting. Visual aura is the main features of sign and symptom. Difficulty concentrating some work. Motion sensitivity. Motion sensitivity means that head is motion, headache is calm. Etiology. Underlying case unknown, can be related genetic or environmental factor. Rarely single gene defect or familial hemiplegic migraine and autosomal dominant pathology. It is mainly occur extracranial branch of carotid artery dilate and ergot. Ergot means the swelling of the blood vessel due to the blood flow increase and other features. This blood vessel ergot resulting stimulating of the pain receptor and activating nerve activation. Treatment. We are divided mainly two types of acute headache and acute treatment and the prophylaxis treatment. We are mainly focusing on the at that time treatment. Mild analgesic, antiemetic and triptan ergot. Prophylaxis means before the disease we treat this patient. Treatment mainly depends on the previous treatment and severity of the attack. Medication over the worst case headache. Therefore, medication consumption, careful management. Analgesic. Analgesic is the pain relief. We are mainly focusing that situation, patient comfortable life. Lot of time we use paracetamol, also NSA1D, aspirin, tolfenamic, diclofenac potassium, also diclofenac sodium, ibuprofen also use. Also we can use antihistamine, buclicine, hydrochloride and codeine phosphate and paracetamol. Antiemetic drug. This sign and symptom is the nausea and vomiting, and we have symptomatic management. We use the antiemetic drug, metoclopramide, a dopamine and weak 5-HT4 antagonist. 5-HT4 receptor is stimulate the vomiting receptor. Domperidone, we are dopamine antagonist. Domperidone we are usually commonly. Metoclopramide use adolescent and women in their 20s, has high risk of dystonia. Sedative antiemetic also use. Triptan. Triptan is the very effective treatment. Triptan at the blood vessel, stimulate the 5-HT1D and 5-HT1B receptor and stimulate vasoconstriction and blood vessel come into the normal situation. This is example samatriptan, rizatriptan, amitriptan and others. But this is main risk factor. This blood vessel constriction, blood pressure increase and blood flow reduce, narrowing of the blood lumen, vessel lumen. It is outcome of risk factor of the hypertension, coronary heart disease, cerebrovascular disease or peripheral artery disease patient cannot be used with drug. Also not use other serotonin drug, lithium. Selective serotonin receptive inhibitors also not use. Drug. You can see main in 3 drug we use. Sumatriptan, mainly subcutaneous and mouth or oral spray, nasal spray. Hypertension, vertigo, tingling or vomiting, side effect can see. We can use pregnancy and breastfeeding this drug. Rizatriptan, oral or intravenously use. Side effect, chest pain, dizziness, dry mouth, tingling, MI, stroke, serotonin syndrome can see. Overdose can headache. Not use pregnancy. Hypertension patient not use. Progesterone, biological active vasoconstriction, has low bioavailability. Used for postpartum hemorrhaging. Structure similar to the neurotransmitter act as ergot. Action of the 5-HT1B receptor. Contraindication, atherosclerosis, Berger syndrome, coronary artery disease, hepatic disease, pregnancy, pruritus, renal disease, Ryan syndrome can be seen. Prophylaxis. Prophylaxis means that we can use treatment before the come into the disease. We mainly use this treatment. This patient has suffered at least 2 attacks per month, are experiencing an increase in the frequency of the headache, significantly symptomatic deficit, suitable treatment for migraine attack. We are mainly use beta-adrenoreceptor antagonists with cyproheptadine, methotrexate act as the beta-adrenoreceptor antagonists act as the beta blocker, opposite action of the dilation of the extravascular vessel. Example: propranolol, metoprolol. Pizotifen use 5-HT antagonist, give single dose at night. Cyproheptadine use the 5-HT antagonist, calcium channel blocker, antihistamine and antiserotogenic use. Methotrexate use semisynthetic ergot, 5-HT antagonist. Thank you.